We're the Ward family. I'm Patrice Ward, but everyone calls me Tree, and I've been living with type 2 diabetes for over 15 years.
I'm Calvin Ward. I was first diagnosed with type 2 diabetes 5 years ago.
My name is Cameron Ward. I play quarterback, and I'm the favorite child out of everyone.
I would describe my family as a very loving family.
When we do everything together, we go on vacations together, play together, we laugh together, we just support one another. And I think that's why we're pretty close-knit family. We do it all. I was first diagnosed with type 2 diabetes 15 years ago. I was concerned knowing that I come from a family history. My parents both had type 2 diabetes, both grandparents. It was scary because I didn't think I would have the life I was used to having.
I was diagnosed with type 2 diabetes 5 years ago. I knew something was wrong. I didn't know what was wrong. I was admitted to the emergency room. I honestly thought I wasn't coming home. It was a terrible feeling, especially because the kids knew something was wrong, but they didn't know exactly what.
And it's been hard watching them live with type 2 diabetes. I call my mom a lot just to check up on them, check up on him, see how they're doing. And, they keep them very active. They take them on walks. They do more exercise than what they did back in the day when I was growing up.
My type 2 diabetes management was not good at all. I was trying to exercise and try to eat better. All the different medications that the doctors were giving me wasn't working to keep my A1C down. When I saw Ozempic on TV, I asked my doctor about it, and then she gave me a sample that day from her office, and I went from there.
I saw the difference it made with her, and so my doctor prescribed Ozempic, and my A1C levels lowered.
My relationship with my doctor is so good that I just got Calvin on board to change over to my doctor because I feel she really cares.
I jumped on board with Patrice's doctor probably about 3 years ago. She's very personable. Sometimes I'm at work and my phone may ring and she's like, hey, I'm just checking up on you. And I've never had that before.
Ozempic is an injectable prescription medicine used along with diet and exercise to improve blood sugar in adults with type 2 diabetes and to reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes and heart disease, and to reduce the risk of worsening kidney disease, kidney failure, and death due to cardiovascular disease in adults with type 2 diabetes and chronic kidney disease. Ozempic is not for children. Do not share Ozempic pen with others. Do not reuse or share needles. Sharing may lead to infection. Do not take Ozempic if you have a personal or family history of medullary thyroid cancer, multiple endocrine neoplasia syndrome type 2, or if you are allergic to Ozempic. Stop taking Ozempic and get medical help right away if you get a lump or swelling in your neck or any of these allergic reactions.
Church has always been my life. I grew up in the church. I played the piano for the church. I've always been a strong-willed person, but sometimes you get knocked back and you think, hey, how am I going to overcome this? And you just pray, and God gives you the strength just to move forward. We've had some tragic things happen in our life, and without faith, we wouldn't have overcome everything that's happened. My mother lost her life from complications of type 2 diabetes, and having to see her on life support has made me think that, hey, I have to do something because I have young kids. I have to do something, making sure that I go to the doctor, make sure that I'm taking care of myself.
Our community is very important because a lot of the younger kids know Cameron from the camps he's put on. They look up to him.
I want to try to stay positive for the kids in our community because I want them to know that you can make it, but you have to be disciplined and you have to go to school, get an education, be respectful, have that personality that will carry you somewhere. And you just have to be that mentor and that role model. Being there for the community and giving back is just something special that we like to do as a family.
It is very important to share my story now because I think there are a lot of people like me that possibly have diabetes and don't know it.
I want to be able to live my life and just continue to be active and just feel good about myself and feel healthy.
I got a second chance. I want to make the most of it. We just have to do the right thing. We have to take our medicines. We have to eat right and we have to exercise.
My family motivates me to keep going in my diabetes management. I want to be able to just grow with them and grow old, to be able to see grandkids come along and whatever their endeavors are. So continue to be supportive parents. I want to continue to be there for all of them.
Serious side effects may happen, including inflamed pancreas. Stop taking Ozempic and get medical help right away if you get severe stomach pain. You may feel the pain from your abdomen to your back. Severe stomach problems may occur. Tell your healthcare professional if you have stomach problems that are severe or will not go away. Gallbladder problems may occur. Call your healthcare professional if you have symptoms such as stomach pain, fever, yellowing of the skin or eyes, or clay-colored stools. Tell your healthcare professional if you have diabetic retinopathy or vision changes, if you are scheduled to have surgery or other procedures that use anesthesia or deep sleepiness, if you are nursing, pregnant, or plan to be. Stop taking Ozempic at least 2 months before you plan to become pregnant. Taking Ozempic with sulfonylurea or insulin may raise low blood sugar risk, which may include any of these signs and symptoms. Some side effects can lead to dehydration, which may worsen kidney problems. Drinking plenty of fluids may reduce your chances of dehydration. Ozempic may increase the chance of food or liquid getting into your lungs during surgery or other procedures. Tell all your healthcare professionals that you are taking Ozempic before you are scheduled to have surgery or other procedures. Common side effects are nausea, vomiting, diarrhea, stomach pain, and constipation. Talk to your doctor about any side effect that bothers you or does not go away. This video is not medical advice and does not replace the advice given to you by your healthcare professional. Talk to your healthcare professional about any concerns you may have about managing your type 2 diabetes. If you're not reaching your blood sugar goal, ask your healthcare professional if once-weekly Ozempic can help.